What's your alter ego, Dr. Bombay, think about this here situation?
I think we should take all of the mental patients and have them take a vacation here. Just make sure that they are adequately drugged so that they do not be delusional. They would all do better if they came here and took their drugs and enjoyed the beautiful scenery.
Viewers, I got to tell you, you are in for a real treat. We had to pay Dr. Bombay to come out here to Santa Barbara, give you a lecture while he's walking along the beach on the benefits of sedation, being drugged.
I came here from India to help these poor mental patients. My good friend, Dr. Richard Dorsey, told me to come here and to drug all these people the proper way. And most of them do not take anywhere near enough drugs to overcome their delusional state. For instance, the person holding this camera, she sometimes thinks she knows better than the doctor. I've gone to medical school for many years. How could anybody know better than me? I am the boss. I know these things.
Ladies and gentlemen, like I said, we are so lucky to have the notorious, widely acclaimed Dr. Bombay.
You are absolutely lucky to have me. Richard Dorsey highly recommended it.
What's the drug of choice, Dr. Bombay? What would really be the most therapeutic drug of choice?
Well, I know that they like these new class of antidepressants, but in me, I really believe Thorazine is the best for everybody.
Thorazine?
Oh yes, it's much cheaper. Much cheaper. We do better when we Thorazine and we just like inject it in their buttocks, and then they can't spit it out.
What about restraints? Is it helpful to use a combination with restraints with Thorazine?
Oh yes. We inject them in the buttocks and then we drag them off and strap them down in restraints. It's a good thing we do to these people. We take good care of them.
All right, you got any parting words for the web people out there that can't afford to go to Santa Barbara Beach and walk on the sand?
I had one patient. She was overweight. We gave her the Thorazine. We strapped her down. 2 weeks later, she lost 20 pounds.
Well, that's kind of harsh.
Oh, but we are doing it out of love because we care for these people.
Okay, folks, we're going to come in back for another installment of Dr. Bombay at a later time. We're going to give him a chance to collect his thoughts. See you later, Dr. Bombay. I have out here Dr. Bombay again. We're looking at all his future clients up in the Santa Barbara Hills. People like Charlie Sheen that are bipolar, just in denial, don't know they need the drugs yet. Of course, with Dr. Bombay's concoction, he could probably have them sedated and therapeutically engaged in their drug rehabilitation. Right there, Dr. Bombay?
I've invented a new depot injection of Thorazine. It's inserted in the body and it slowly time releases over 2 weeks' time so that we can keep these people drugged up properly.
And there you have it.
Don't keep them drugged up properly, they cannot be compliant with their treatment and they get sick all over again.
That's right, and we also have an audience going around us trying to eavesdrop on all your special remedies for your drug concoctions.
Well, if they fight against the help that we try to give them, then we take them into seclusion and restraints and we strap them down and we give them the help. So one way or the other, they are going to get the help they need. And I will be considered a great humanitarian.
So Dr. Bombay, are you excited about your new prospects here up on the Santa Barbara Hills?
Oh, absolutely. I've got these boats out here that you see. These are going to be the new apartments for the homeless.
Let's check out the boats he's got in mind. Oh yeah, he's definitely getting ready to clean up. This is like going pearl hunting, right, Dr. Bombay?
And do you like my new Lincoln SUV? It has plenty of room in my new Lincoln SUV.
Nice.
Plenty of room in the trunk to keep the non-compliant mental patients. We lock them in a cage back there until we can get them to the hospital where we can treat them properly.
Nice going. So, do you have anybody in your residency program?
Anybody? I know my residency. Oh well.
Well, you must have some prospects to pass on your forced drugging to them.
Well, we have this one doctor from Guatemala. He doesn't quite speak English yet, but he does understand. Inject him with the drugs, which is all he needs to know. I put him on duty when I take off. He comes on on duty, and then everybody who comes in, I've written orders for him to just drug them. and then I can come in later and check on them and see if they're okay. If he hasn't given them enough drugs, I come in later, I give them more. It all works out very nicely. And then, if they are not compliant, oh, he makes them, he has the greatest bedside manner because they all become very compliant. Mental patients are tricky fellows. You have to watch them because they will say that they don't understand, but we know that they do. When we tell them they have to comply, they say, oh no, I don't want to comply. But we know that they understand that they must do this. It's for the best.
Because you care so much about all your patients, don't you, Dr.
Absolutely.
Bombay?
I'm a great humanitarian.
You're doing it for the best interest.
I came to this country, and I do this for their best interests. This is, we have to set limits on them. They don't get it. Without limits, we would have chaos and anarchy. We have to set limits on them. So we drug them up, and we take good care of them, and they all love it.
Thank you very much, Dr. Bombay. We'll check on you later after you collect some more of your thoughts. Good evening. All right, we're here with Dr. Bombay, and he's eating dinner here with all the kickback he gets from Big Pharma for prescribing all his special cocktail of special Thorazine mixed with some of the other drugs on the market. Give us a smile.
The more I prescribe Thorazine, the more lobster I get to eat. It's a good perk.